All right. So again, thank you for having me. My name is Sidique Furet. Today I'm going to be talking a little bit about let me close this. Walk through how historical housing policies, especially redlining, connect directly to the lead exposure that we see in Baltimore. Um, so we'll start with the history of the housing policy. We'll walk through how redlining has shaped neighborhood development. From there, we'll connect that to housing disinvestment and how conditions have changed over time. Then I'll focus on specifically about lead, how it was used, regulated, and kind of how exposure happens today. And then finally, I'll connect that to kind of current health outcomes and some key takeaways. Right. So, racial housing segregation really began in Baltimore. In 1911, a black Yale graduate bought a home in a white neighborhood, and that kind of triggered the Baltimore mayor at that time to issue a city ordinance. He said, and I quote, "Blacks should be quarantined in isolated slums in order to reduce the incidence of civil disturbance, to prevent the spread of communicable disease into the nearby white neighborhoods, and to protect property values among the white majority." Now, this ordinance prohibited Black Americans from moving into any blocks that were more than 50% white. This ruling was deemed unconstitutional by the Supreme Court in 1917. However, even though that law was made illegal, the segregation basically just evolved from there. And by the 1930s, instead of telling people where they could live, the system turned into redlining, which controlled where the money went, where the investments went. And the result was still the same. So Black communities were still separated, segregated, and under-resourced. And then moving to the 1930s, is where redlining really takes off. It was a federal policy in the 30s that denied mortgages, financial services to neighborhoods labeled as high risk or hazardous, which were often predominantly Black communities. Um, and then by that time, many of the homes in Baltimore were already very old. Baltimore is a very old city, and lead paint was still widely used at that time. So you have very concentrated areas of poverty, um, old homes, and then a system where there is no money going into those communities. So those old homes, they start to age and deteriorate, and all having lead and creating that lead exposure. So over time, this kind of created the conditions for the lead poisoning crisis that we see today. And it wasn't until the 1968 Fair Housing Act that this practice was banned. But if you think about it, from 1911 all the way up until 1968, the system itself was made to push minorities and blacks into very concentrated areas where there was no investments going into the communities. And we see the map here. So the red was listed as hazardous, yellow was listed as declining, blue is desirable, and then green is best. And this is a very famous map. We see this map in many other cities as well. And you can directly, if you overlay this map and some other maps, you can see the effects of redlining. I'll show you that in this next slide. So we see on the left from 2017, the amount of vacant and abandoned homes in Baltimore, and on the right we have the redlining map of 1937. And you can clearly see in East and West Baltimore, in the Curtis Bay area, in Cherry Hill, Brooklyn Park, you see kind of the concentrated areas where there is a lot of vacant and abandoned homes. And on the right, you see this is where the red communities and the yellow outlined communities are mainly concentrated at. There's many other maps similar to this, but the housing practices of the 1930s and the redlining directly affect the issues that we have today. And it wasn't just Baltimore. Baltimore was the first, but this was a practice that was done over in over 200 cities throughout the U.S. Um, Here is on the left is Philadelphia, and you see kind of a drastic shift on the bottom portion. You see all the red line districts, and in the top portion, you see the blue and green, and then on the right is Atlanta. So um, all these cities show the same pattern. Areas that were historically redlined, they still experience higher vacancies, worse poverty, and worse health outcomes today. And talk a little bit about how redlining shaped Baltimore's housing. It basically meant that certain neighborhoods, especially in East and West Baltimore, were denied investment. This limits the access to mortgages, decreases home ownership, and which also decreases the opportunities for wealth buildings for minority and Black families. And then without the reinvestment from the city into the communities, all these areas start to deteriorate. So over time, maintenance is not kept up, repairs are not being made, which create a worsening housing condition. And then this, on top of the concentrated poverty, in the long term, again, long-term disinvestment in in these neighborhoods really contributes to the negative health outcomes in the future. So it didn't just shape where people lived, but it shaped the conditions of the homes that they were living in. So again, without investment, housing does not improve. We see high vacancies today. We see many homes in need of repair that are being put off. They're highly concentrated in certain areas in the city. There is between 13 and 15,000 vacant homes in Baltimore. And over time, small issues like peeling paint or leaks just get worse over time and create even worse health risks for the community there. Like I mentioned earlier, Baltimore has one of the oldest housing stocks in the United States. Nearly half of Baltimore's housing, about 47%, was built before 1940. Um, on a national level, lead was banned in 1978. Baltimore was a little bit ahead of the game, and we did it in 1951. But still, half of the city was built before 1940. So there's still a lot of lead paint in the city. Again, a lot of it is concentrated in these poor neighborhoods who that have not been, renovated, and they're still in the same conditions that they were 20, 30 years ago, where the lead paint is starting to deteriorate and create a really, really bad environmental risk. Um, and on top of that, these neighborhoods, they tend to have fewer trees, more pollution, worse infrastructure. So that environment alone adds additional risks. The average home in Baltimore is around $185,000 to own, which is much lower than the national average. Um, and while, you may say like that sounds really affordable, really it just reflects the long-term disinvestment in certain neighborhoods. So the issue isn't just that, Baltimore's housing is old, it's that it's been aging without any investment that is needed to maintain it. Okay. So lead in Baltimore. Lead was widely used in paint. It makes it more durable. It helps it dry faster. It protects surfaces from moisture. Lead is a naturally occurring metal, and it's been used for thousands of years. Excuse me. And even back then, they knew that it had some negative health outcomes. Um, but again, it's a cheap metal to use, and it does have some desirable um, attributes that makes people want to use it. Many European countries actually began restricting or banning paint as early as the early 1900s. But for the United States, it took us up until 1978 to actually put in a national ban on lead paint. But again, banning it, all that, it helps, so future homes are not being built with it, but the hundreds of thousands of homes that have been built in the past, they still have lead hazards. Specifically in Baltimore, there's over 85,000 occupied housing units in Baltimore that have dangerous lead hazards. Um, you can still get exposed even if you're not living in a hazardous home. You can get it from the vacant home next door. So lead is really very abundant in Baltimore. It causes, or lead exposure causes permanent brain damage, developmental delays in children, um, and again, it's disproportionately affects Black and minority communities. So if you're under the age of 6 is where you are most at risk. Lead is a neurotoxin, so it attacks the brain specifically. And the problem with it is that sometimes it's not obvious that you may be lead poisoned or have elevated lead in your blood, so it can go undetected for years and years and years. So there are people out there who are facing the negative effects of lead poisoning without even really connecting the dots. So the issue isn't just that, lead exists, it's where it exists and the conditions as well. So redlining, housing segregation, and concentrated Black families in older neighborhoods. Disinvestment leads to aging and poorly maintained housing stock, which more often than not contain lead-based paint. And as that paint deteriorates and creates that lead dust in the home, it results in elevated blood levels. And then that creates lifelong health impacts. So, um, it's not really a coincidence, it is a pattern how redlining and how housing segregation contributes to the issues that a lot of minority and Black communities face today. And talking a little bit about the long-term outcomes or impact of lead exposure. So again, on the left, we see a lot of different symptoms, nausea, stomach aches, muscle joint pain, dizziness, headaches. So these will not always be super obvious to you, and you may not identify these with your child. You may just think that, they're dealing with something else. So again, it's not always obvious that this is lead and this is something that I need to take care of. Testing is the number one way to uh, know if you have lead poisoning. So in Maryland, it is required at age 1 and 2 to get lead tested. And then if you're going to the doctor and you're doing any type of blood work, you should always be checking the lead. It is not as dangerous for adults, but it can still have a lot of negative uh, effects. But again, for children, talking about impaired brain development, learning and attention difficulties, behavioral challenges, lower academic achievement, and then increased risk of long-term inequality. So they basically turn a childhood disadvantage into a lifelong disadvantage. And then because children under the age of 6 are they're in their critical stages of development. That's why it is most dangerous for younger children. Also because they are generally more at risk to get exposed to it. A small child crawling on the floor, standing or hanging by the windowsill, they're directly exposed to the lead dust. And then one thing that a lot of people know is that lead dust, it actually has a sweet kind of taste to it. So, if a child is crawling around the windowsill and they're getting dust on their hands from, you know, a rundown home, and they put it in their mouths, and then they're just gonna kind of keep rewarding themselves that dopamine, um, and just constantly just, putting their hands in their mouth. So that's why children are more at risk and they really need to be, monitored. Um, Talk a little bit about lead prevention and simple ways that you can avoid. or prevent the exposure. So as I mentioned before, regular lead testing, they have to be tested at 1 years old, 2 years old, and there are some, schools they might require a lead test before you enroll. If you have any chipping, peeling paint, must be maintained and repaired. So lead itself, like lead paint, if it's like freshly painted, that's not a risk. It's when it starts to deteriorate in older homes and not maintained is when it becomes a hazard. So that dust is really fine and it's very easily, agitated. It stays in the air for a while. It can settle throughout the home without you really seeing it, and you can easily ingest it. And then just wet cleaning, reducing the lead dust in the home, and providing a nutrient-rich diet. So vitamin C, calcium, iron, they very important for a lot of reasons, but it helps reduce the amount of lead that you absorb. So if you're already lead poisoned, um, eating these things don't necessarily bring it down, but if you are eating a good healthy diet, uh, that will help reduce the amount of lead that you absorb. And this goes back into, redlining and being in, concentrated areas of poverty where you may not have access to good nutrients. You may not have access to a good primary care provider where you can get lead tests. You may not have access to the ability to repair and maintain your home. So that just kind of creates a cycle and increases the risks over time. And then the long-term impact. So again, the redlining started in the 30s. It wasn't until 68 when it was banned, but we still see the results of that today. So, and this is specifically for children with elevated lead levels, up to 7 times more likely to drop out of school, up to 6 times more likely to enter the juvenile justice system. And again, it reinforces that cycle of inequality. Children who, with no fault of their own, are in situations where they're exposed to lead and then they're struggling throughout the rest of their lives. So again, there's lifelong health and economic consequences. And this is coming from the National Bureau of Economic Research. Um, Again, it affects development, education, long-term outcomes, and even a small amount of lead in a child's blood can shift their entire life trajectory. And going back into health outcomes, so our lead crisis is not random. It's a direct result of policy, segregation, and redlining, which has led to huge areas in the city that was not invested in and created a condition where we see more and more lead exposure. Um, it's really the result of decisions that were made decades ago. It's something that we can prevent today. The things that I mentioned before about how to uh, reduce your risk of exposure. Lead poisoning is 100% preventable, but parents and community just need to be not knowledgeable of it. But health outcomes specifically in these areas, we see higher rates of elevated blood levels. Most cases that we deal with are, minority children. We have an asthma program here at the health department as well. And same thing. Some of those families, they're dealing with lead issues, lead exposure, and they're also dealing with asthma because the homes are, um, you know, maybe they're getting a little bit more run down. There might be mold. There might be, high levels of dust. And again, lead dust as well. So asthma is a huge issue in minority communities, as well as, uh, hospitalizations as a result of lead or asthma. We see a greater burden of chronic diseases, so diabetes, high blood pressure. There's lower access to quality health care. And then there is overall a 5-year lower life expectancy in red line areas. So you can really draw a lot of parallels from uh, the policies that were made years ago and the health outcomes that we see today. And some key takeaways. Um, so lead exposure in Baltimore is 100% preventable, but again, it is very widespread. We are doing our best to educate the community so they know where the risks are and how to mitigate them. Aging housing is the primary source of exposure. So, excuse me, lead paint. So deteriorating lead paint is the number one source of lead dust and lead poisoning. In other areas, it could be lead and spices. There are areas that it is the pipes, but in Baltimore, it's the paint. And redlining disinvestment has created today's high risk neighborhoods. We see that there's 100 different maps that kind of can illustrate this, and lead exposure leads to lifelong health, education, and economic struggles. So it's very uh, it's a difficult issue to solve, and it's hard because it's not a situation where if someone's exposed to lead and we give them some medicine and then they're back to 100%. Um, the effects of lead exposure are permanent and they affect you for the rest of, which means they affect you for the rest of their lives. And then addressing lead means we really have to address housing issues, inequalities, structural inequalities, and really building up the community and getting more investment into it as well. So it's not just about removing the pain; it's about addressing, housing and broader conditions that have created these risks. So the history of housing in Baltimore still shapes health outcomes today, specifically in low-income minority populations. But our program is working, with families. We are trying to get the word out, as well as uh, our partners, Young, Gifted, and Green. We are working on getting people more knowledgeable, letting them know the resources that they have to improve their living situations, to help their families, make ends meet. So we are working towards a better Baltimore. So um, thank you for your time. I really appreciate it. If you have any questions, I believe we'll have a quick Q&A sessions, and I'm really happy to answer any questions that you may have. Thank you.
Yeah, thank you. So DK, if you could tell us some of the actual services I know that we spoke about that the health department provides after you test a student, I mean a child that is test positive that's 6 and under, like talk about some of those services that you all provide.
Yeah, definitely. So, we are connected with the Maryland Department of the Environment. They will let us know if a child is ever tested positive, and then we will open up a case for them. So, once we open up a case, we will do a home visit. We'll talk with the families. We'll give them some cleaning supplies. We'll teach them how to use the cleaning supplies. Um, our community health workers will maybe do a visual inspection of the home and see if we can kind of point out where the lead is coming from. And then if they're interested, they can even have one of our environmental sanitarians come home and do a little bit of a deeper inspection of the home to determine where the lead is coming from. And then we will work with them. So if they're having issues with their landlord and their landlord is not repairing the homes, we can work with them to file a notice of defect. We can work with them to possibly put the rent in escrow, maybe even connect them with the housing authority to even move them out of that situation. So we basically open up a case with them and then we'll work with them until they get the lead hazards removed and until we get the child's blood levels back down.
Thank you.
Hmm.
Are there any questions? If there are none, David, you actually completed the pre-quiz, um, the fastest and got all the answers correct. And I do have your email. I will send you your Amazon gift card. So thank you for that. Thank you, Sidique, for your presentation. I really appreciate it. Based on the things that he discussed, I am going to launch the post quiz, give you all 2 minutes to complete it, and then we'll go from there. All right, got about 40 seconds left. Okay, time is up. All right, I will actually share results with you all, but then I will look at it separately, and then I'll let you know who completed it and got all of the answers correct. So we come to the part of the um, agenda where we talk about the different services that are being provided in Baltimore by some of the partnering organizations. And so we're grateful for those partnerships and the work that they're doing in Baltimore. So we're going to allow each one of those organizations to tell us what exactly that they do and any priorities or initiatives that they're working on right now that they could use support on or need signatures or things of that nature. So actually, we're going to start with Anjali. Anjali, I'm going to start with you. You can go first and you can just introduce yourself, your organization, and any initiatives.
Thank you, Joshua. My name is, and can you let me know about how many minutes I have?
I think 2 minutes is good.
Okay, great. Thank you. My name's Anjali Galati. I work with Interfaith Power and Light DMV. So we work with congregations locally to respond to climate change through going green, learning together about the harms of burning gas, and speaking out. And I'm going to link our website here in the chat. One of our biggest campaigns going on right now is in regards to placing human wisdom at the center of the data center debate, and making sure that there's responsible data center development in the state of Maryland. Um, but furthermore, I want to focus on our Baltimore City efforts with Electrify Baltimore. Electrify Baltimore is a coalition that's comprised of Interfaith Power and Light DMV, Chesapeake Climate Action Network, Green and Healthy Homes Initiative, and No Boundaries Coalition. And together, we are documenting the harms of burning gas indoors in compiling that evidence to pressure the city council to introduce legislation that will mandate all future construction to be all electric. Now, we have done this work before in Washington, D.C. and Montgomery County, Maryland. And the next thing I'm going to put in the chat is our report published by the Beyond Gas Coalition, which was after we found after testing the NOx or nitrogen dioxide emissions of nearly 700 kitchens, we found that nearly two-thirds of those gas burning kitchens were emitting nitrogen dioxide at rates higher than what the EPA has deemed safe level of exposure for indoors, which is, well, they actually only have an outdoor standard. So we were using that outdoor standard. That's 100 parts per billion. So I've personally been in residences that I've seen the monitor that we use go up to in the 400s, in the 700s even. Now, another part of this is that Maryland does not mandate that all ventilation is actually leading to the outdoors. So, above your gas stove, there's a fan. A lot of us use that fan, which can be kind of noisy, but, I typically use it when there's like some food that is smelling really strong to dissipate the odor. And the vent is also meant to vent the emissions outdoors. But sometimes if the home doesn't vent to the outdoors, that vent is just blowing the gas around. So we're trying to get evidence through community science. One of us four organizers actually going into homes for around 45 minutes with the gas stove on and seeing what reading we get on the NO2 monitor that we have and compiling that evidence to see, where are there which parts of the city have more gas appliances than other parts, and even what is the square footage, what size of the building, how does the layout of the home affect the NO2 levels. And in the efforts of trying to introduce this legislation that'll mandate all future construction to be all electric, this is also pushing back against the unbridled investments that BGE is making in new pipeline infrastructure. We don't really need new gas when we know all electric appliances are safer. There's less risk of an explosion, and it's also healthier for our breathing, clean air. So, Baltimore City residents are, compared to the state of Maryland, are 3 times more likely to be hospitalized for asthma. And there's enough research out there that links NO2 and other pollutants that come from our gas stoves to developing asthma, especially for children and elders. Um, I'll leave it there and I'll just put in the chat also our link to get involved. So if you have a gas stove that you want tested for free, or your congregation has a gas stove or your community center, or you just want to stay involved in the campaign and in the advocacy loop, please do fill out this Google form and stay involved. And thank you so much, Joshua, for making time. Ooh, I think you're muted.
I keep doing it. No, thank you so much. Next, we'll do Center for Community Engagement, Environmental Justice, and Health.
Shelby Wilson. I
Yeah.
am exec director of CJINC and also a professor and director of the EJ Lab, University of Maryland College Park. So happy to be here. So a lot of the work that we've done over the last 15 years or so have been supported for helping to grow the EJ movement in the state of Maryland, also the Mid-Atlantic region. When it comes to some of the general work, we built mapping tools. So I'm going to put some stuff in the chat. We have 2 tools that there's a Maryland. So we built environmental justice. We call it environmental justice screening and mapping tools to help you basically map environmental justice burdens. So one of our tools is Mid-Atlantic EJ Screen. And that's a tool that you can use to map environmental justice at the census tract level in the state of Maryland. And so one of the updates to that tool that's relevant to this discussion is we actually now, so I just put a link to the tool in the chat. We actually now have segregation data that's available. So Sidique just talked about, history of redlining and segregation in Baltimore and how that really inequities in planning, zone, and development drive environmental justice, right? And so that's something you could look to map, use a tool to map your environmental burden. But also now we have a sub tool where you can actually map segregation data, and that's through data, both racial segregation data and economic segregation data that we gotten from University of California Berkeley team that really provides this type of data, data available for folks. So those tools that tool is very important. We also have a tool called Mid-Atlantic EJ Screen that lets you do the same thing across the Mid-Atlantic, DC, Delaware, Virginia, Maryland, and Pennsylvania. Another resource just I put in the chat talking about just to follow up on the presentation, Dr. Lawrence Brown's book on the black butterfly. So it talks about how in the wings, East and West Baltimore, hyper segregation, economic racial segregation. And then you look at, the spatial patterns of, inequity. So home prices are lower in the wings compared to body of the butterfly. Food improvement zones or food deserts. There's more of those in the wings of the butterfly compared to the body of the butterfly. You also got life expectancy differences, major differences in the wings of the butterfly compared to body. Lead cases, wing compared to body. Also, heat issues. Check out a Baltimore Code Red. That was a project that looked at issues around climate change and heat issues in Baltimore. So you see similar patterns of heat differences because of redlining. Redline areas have a 10 to 12 degree difference in temperature compared to non-redline areas. So that's a really important book to look to. Also, just real quickly, we have something called a Mid-Atlantic Climate Action Hub match, where we're engaging communities to help build a capacity around climate change issues, to address climate change. We have provided grants to groups in Baltimore, including the Baltimore Star Project and Lynn Pender's group. Since I want to say that, we also partner with South Baltimore Community Land Trust on air quality monitoring. So a lot of what we do, it's important to understand like how red line and segregated areas have more concentrated poverty and also more concentrated environmental risks. So we've been working with SBCLT, which we'll talk about there, I think, some network, and doing air quality monitoring in Curtis Bay. Also, some air quality monitoring in Turner Station, which is where Henrietta Lacks is from. You think about HeLa cells. So so you can find out more about what we do going to siege.org. And just on one last comment, we also are doing a lot of new work on data centers, both in Prince George's County, and we've been supporting Justin Pearson, Keyshawn Pearson, MCAP in Memphis. So we're going to try to work with, Latricia on that, but we're doing air quality monitoring there around the Elon Musk facility. And we want to bring that work more in the state of Maryland, because if y'all don't know, in the state of Maryland, they're bringing more hyperscale data centers. So we got to be on top of that. So I'll pass the mic back.
No, thank you.
Yes,
Thank
sir.
you. Is there anyone for Be More Just Transition? Okay. South Baltimore Community Land Trust?
You hear
If
me?
not, yep, I can.
All right. Hello,
Hey,
everybody.
Melanie.
Good
Okay.
evening. It is Melanie Thomas, Director of South Baltimore Community Land Trust and focused on our housing development work. So, as Dr. Wilson just shared, we continue to do air quality monitoring in the community. We have some pilots where we've been doing like some health panel studies where people keep monitors in their homes for a period of time, and then we take that and they're compensated for that. We are also doing permanently affordable housing development. So looking at the way we build, the materials we use, the types of um, things used in the homes too. Our homes are all electric. Um, and that's another issue. I won't go on that tangent right now because we got to do something about the price of electricity. But for the most part, we are really focused in just overall health of healthy housing as well as our air, because we can't have a healthy home in an unhealthy environment and vice versa. So making sure that we're covering all those bases and um, providing quality and dignified housing and opportunities where people can learn about what environmental justice is, what it isn't, and how to advance things, practical things within their home and their environment to help live and be more healthy. And I will drop our website in the chat. But thank you all for this work and all the initiatives that you're doing.
Thank you. And the last but not least, we have Chesapeake Climate Action Network. Okay. And so Young Gifted and Green also has partnered with DPW to do scratch tests to determine what type pipe you have entering the home. And so if people are interested in that, that is something that we're doing once a month. We go out and canvas. We go to the residents' home to support them with putting that information and data into the DPW website. So we'll actually come out, ask them a few questions about their home, the age of the home, have they had any new pipe replacement? If so, if they know what material was used. So we ask a few questions and then we take pictures. We do a scratch test on their actual um, main water line that's entering the home. We scratch test, take a picture, and we upload it into the DPW website. And then DPW on the backside actually confirms what we believe that the findings were. And so we have a actual tool that helps us to determine if it's a copper pipe, steel, if it's PVC, different things of that nature. And so we'll do that for the resident and upload it. And then DPW updates their GIS map. And so everyone's address should be in there, but if it's not, we will actually report that and make sure that it is entered into the system. We also, if families want, if they have, if I see children when I go out that are young children or elderly, and we are unsure what it is, we can provide them. I'll turn their name in to receive a water sample testing, and so DPW will go out and actually test the water, as well as provide them with a water picture, and so that is all based on me letting them know. And so that's something that if you know anyone who is interested or would like to sign up for that, I'm gonna drop the link inside the chat. Give me one moment here. And they can sign up and I will get them on the list and get them added. The link is now in the chat. So you can take that and share with your network of people, anyone who is interested, and we'll get that done. And we do referrals. We do blood level um, referrals, level referrals. I'm sorry, um, as well. So just let us know, and we will make sure we support any way that we can. Are there any questions or anything? I just want to make sure I didn't miss anything before I move on. I want to thank you all tonight for being here. Thank you, Sidique, for doing the presentation today. This is the first one of four. We have four, so the next one will be in June. And so we will be getting that information out to everyone as we look as well. If anyone is interested in being a presenter, I will let you know what the topics are. You can just reach out to me by email. I'd love to partner with anyone based on what the topics are and that are already been kind of put in place. I will put my email in the chat. Most of you should have it, but if you don't, I'll put it in there. And my name is Joshua Perkins. Reach out to me and I'll make sure I connect with you. We can meet and just talk about some things. I do have some connections I need to make as well. Melanie, I have not forgot about you. I'll actually send that email to you tomorrow um, regarding testing. So that's something that I will do. Let me look right quick and then I will let you all go to announce who completed the post quiz and actually got those answers correct. So, all right, here we go. Ah, second round. Okay. So this time, Melanie, you actually did. You got all of them correct, and you were the first one to complete it. So I have your contact as well. I send you your Amazon gift card as well. If there are no more questions, all minds and hearts are clear. Um, we're good. Thank you all so much, and that is the end. And I will let you all enjoy the rest of your day. Thank you.
Thank
Yes, sir.
you.
Thank you.
Bye.